Did you know? There is a disease silently taking tens of thousands of lives every year in the United States. It's not as loud as lung cancer. It's not as easy to detect as breast or colon cancer. This disease moves like a shadow, hiding deep inside the body. And by the time it's discovered, it's often too late to turn things around. I'm talking about pancreatic cancer, one of the deadliest and most difficult to detect cancers today. According to U.S. statistics, over 65,000 people are diagnosed with this disease each year. And sadly, nearly that same number of people don't survive. The 5-year survival rate is only about 12%, a shockingly low number in today's medical world. Why is that? It's not because it can't be treated. It's because it's just too silent. The early symptoms of pancreatic cancer are often vague. A little fatigue, some indigestion, a slight feeling of fullness after eating, even just a loss of appetite. We've all had these things happen from time to time. So no one really suspects that something serious might be growing inside them. Margaret Lee, a 62-year-old woman from Oregon, went through this herself. She shared that for 5 months, she thought it was just stress or aging. It wasn't until she noticed her skin turning yellow that she went to the hospital. And the result? Stage 3 pancreatic cancer. Not everyone gets the chance to tell their story like Margaret did. But you can know ahead of time. Recognize it early. And act before it's too late. Here's the good news: researchers in the U.S. have discovered something important. There are at least 3 early signs that can appear 3 to 6 months before pancreatic cancer is officially diagnosed. That means, if you or someone you love notices these signs and gets checked early, the chances of successful treatment may rise up to 70%. We're talking about the pancreas, a small organ about 6 inches long, tucked behind the stomach. It plays a critical role in digesting food and regulating blood sugar. Because it sits deep in the abdomen and isn't easily accessible, tumors often grow quietly without being noticed. I know. Statistics like these can sound frightening, but there's no need to panic. What you need is the right information and good timing. Today's article will help you. Understand the 10 silent warning signs of pancreatic cancer. Know when it's time to see a doctor, and learn how to listen to your body with calm and confidence. You may not be a doctor, but you absolutely can be the one who saves yourself, and maybe even someone you love, just by paying attention at the right moment. So if you're middle-aged or older, or have loved ones over the age of 50, please don't ignore what's coming next. And if you find this helpful, share this information with someone you care about. It's more than a kind gesture. It could be the action that changes a life. Keep listening. Right after this, I'll walk you through the very first symptom that most people overlook. But it could be the earliest warning sign of pancreatic cancer. 10 early warning signs of pancreatic cancer. 1. Jaundice, the first sign you might actually see. One morning, you look in the mirror and notice your skin looks paler than usual. It's not from being tired. It's not because of poor sleep. It's a slight yellow tint, something you'd barely notice unless you really paid attention. When you look more closely at the whites of your eyes, you might see a faint yellowish hue. And this could be the very first signal your body is trying to send you. In many cases, pancreatic cancer begins with a tumor at the head of the pancreas. That tumor puts pressure on the bile duct, the tube that carries bile from the liver to the small intestine. When that flow is blocked, a yellow-colored pigment called bilirubin begins to build up in the bloodstream. From there, your skin starts to turn yellow. Your eyes begin to change color. You may also notice your urine turning dark, like the color of tea. Your stool may become pale, sometimes gray. And you might develop itchy skin without any obvious rash or bumps. Many people dismiss this symptom because it doesn't hurt. It doesn't cause much discomfort. But in reality, it's one of the clearest and earliest signs your body can give you. If you notice changes in the color of your skin or eyes, even if the change is subtle, it could be your pancreas speaking up for the first time. 2. Unexplained weight loss, when your body can't hold on to what you eat. Plenty of people feel happy when they lose a few pounds. But if you lose 10 to 15 pounds in a short period of time, without dieting, without changing your routine, and without any major stress, then it's time to pay attention. The pancreas is the organ that helps digest food by releasing enzymes. These enzymes break down fats, proteins, and carbohydrates. But when the pancreas is damaged by a tumor, the enzyme production is disrupted. Your body begins to have trouble absorbing nutrients. You're still eating 3 meals a day, but your body isn't holding on to what you eat. In addition, if the tumor grows, it can press against your stomach. You may feel full quickly and eat less than usual. And since your body is using more energy to fight off what it doesn't recognize, the weight loss happens, even if you do nothing different. Unlike weight loss from exercise or healthy eating, weight loss from pancreatic cancer involves losing muscle and fat silently and uncontrollably. You might notice your clothes feel looser. Friends may comment that you look slimmer, but you feel tired. There's no clear reason, yet your body feels lighter and weaker day by day. That's when it's time to listen to what your body is telling you. 3. Abdominal pain that spreads to the back, a dull ache that lingers. It might begin as a slight discomfort in the upper abdomen, just beneath the breastbone, sometimes off to the right a little. At first, you think it's indigestion, but then the pain doesn't go away. Sometimes it spreads to your back. It feels like a thin, stretched out band pulling from the front to the back. This is a fairly common symptom in people with pancreatic cancer. The tumor grows quietly in the pancreas and may press against nearby nerves. Because the pancreas sits close to other organs like the liver, stomach, intestines, and gallbladder, the pain often isn't clear. It's dull. It lingers. And sometimes it gets worse when you lie down or after eating. Many people mistake it for a stomach ache, muscle pain, or a back issue. They take pain relievers, apply heat, and unknowingly delay the diagnosis of something much more serious. What's important to understand is this. Pain from pancreatic cancer doesn't come and go like a normal ache. It sticks around day after day, and over time, it becomes more persistent, disrupting sleep and draining your energy. If you're dealing with abdominal pain that has no clear explanation, and that pain begins to spread to your back, watch for other symptoms, too, like weight loss, loss of appetite, or yellowing skin. For digestive problems, when your stomach speaks up for your pancreas. Have you ever felt uncomfortably full after eating just a little bit? Or noticed mild nausea, especially after eating something greasy or rich? Maybe you've experienced alternating bouts of diarrhea and constipation that last for weeks, without any clear reason? These symptoms are often mistaken for ordinary digestive issues. Many people blame stress, unusual foods, or even vitamins. But sometimes, the real cause lies in an overlooked organ, the pancreas. The pancreas produces enzymes that help digest food, especially fats and proteins. When there's a tumor in the pancreas, the amount of enzymes released may drop significantly. As a result, food doesn't get fully broken down. You might notice that your stool is lighter in color than usual. It may float, have a strong smell, and appear greasy because of undigested fat. Over time, this poor absorption leads to nutritional deficiencies. You feel tired even when you eat enough. Eventually, you may start losing weight and never suspect the cause is in your digestive tract. The thing is, digestive symptoms related to pancreatic cancer are easy to dismiss. There's nothing dramatic, no severe nausea, no intense vomiting, just mild, lingering signs, and if you don't pay attention, you might miss them. So if you regularly have unusual digestive patterns and feel like your body just isn't working the way it used to, consider that as a quiet warning from within. 5. Loss of appetite when your mind and body stop craving food. I just don't feel hungry these days. Food doesn't taste the same anymore. The smell of food makes me want to turn away. If you said things like that, and the feeling has lasted for weeks, then it might be more than just a change in taste. In some people with pancreatic cancer, appetite loss can appear early. A growing tumor may press on the stomach, making you feel full even after just a few bites. It can also interrupt the signals between your digestive system and brain, the very place where hunger and enjoyment of food are controlled. You stop feeling like eating. Your favorite meals no longer appeal to you. And sometimes, just thinking about food makes you tired. As your appetite fades, your body starts to lack key nutrients. not enough protein to maintain muscle, not enough vitamins to support your immune system. That leads to real consequences. You lose weight, your body weakens, and your risk of infections increases simply because your defenses are too low. Loss of appetite happens in many health conditions, but in pancreatic cancer, it tends to creep in quietly. It doesn't come with loud symptoms. It's not aggressive, but when combined with weight loss, fatigue, or mild nausea, it becomes a clear puzzle piece in a much bigger picture. 6. Sudden-onset diabetes when your blood sugar speaks for your pancreas. You've always had normal blood sugar levels at your checkups. Then out of nowhere, your doctor tells you that you have diabetes, even though you're not overweight, no family history, and no big changes in your diet or lifestyle. Sounds unusual? Actually, this is one of the early signs of pancreatic cancer that often gets overlooked. The pancreas is responsible for producing insulin, the hormone that helps control blood sugar. When a tumor interferes with that function, insulin production drops. Blood sugar starts rising, and suddenly you're diagnosed with diabetes. Here's what's surprising. In some patients, after their pancreatic tumor is treated, their blood sugar levels return to normal, which means, in these cases, the diabetes isn't chronic, it's a symptom caused by the tumor. Unlike typical type 2 diabetes, diabetes related to pancreatic cancer shows up suddenly, and it usually affects people over 50 who don't have common risk factors. You may feel thirstier than usual. You may need to urinate more often. You could lose a few pounds in a short time. And sometimes, there's blurry vision or unexplained fatigue. These subtle changes are easy to blame on aging or shifting seasons. But when paired with symptoms like appetite loss, weight loss, or digestive changes, they may be the quiet knock of something far more serious. 7. Persistent itching, a strange sensation that often goes unnoticed. Everyone has experienced itching at some point, from allergies, from dry skin, from the weather. But if you feel a deep, lingering itch for several days, with no rash, no visible irritation, and especially if the itching gets worse at night, don't be too quick to assume it's just a skin issue. When the pancreas starts having problems, especially when a tumor presses on the bile duct, bile can't flow freely from the liver into the intestines like it normally does. At that point, bile salts and bilirubin begin to build up in the bloodstream. And one of your body's reactions to this buildup is itching. Not the kind of itching that stays in one spot, but a widespread, all-over kind of itch that's hard to describe. Your skin may look perfectly normal, but you feel crawling, tingling, or mild stinging again and again. The more you scratch, the more uncomfortable it becomes. This kind of itching often leads to poor sleep, irritability, and even confusion over whether it's just a hidden allergy. A woman named Sarah, 61 years old, living in Wisconsin, said she switched all her laundry detergents, even changed her bedding materials. But the itch lasted for months. Eventually, when she saw her doctor about mild jaundice and dark urine, she was diagnosed with early-stage pancreatic cancer. Itching can be a vague symptom, but if it's paired with yellowing skin, dark urine, and pale stool, then it's no longer just a skin issue. 8. Ongoing fatigue, the kind that doesn't go away with rest. Fatigue is something we all experience. But there's a type of tiredness that's unlike anything you've felt before. It lasts day after day. Even after a full night's sleep, you're still tired. You feel exhausted doing nothing. Just walking a few steps can leave you short of breath. This kind of fatigue doesn't come with a cold, no fever, no cough. It's just a deep, quiet exhaustion that won't let up. It's as if your body is running a marathon and you didn't even know you signed up for it. Pancreatic cancer, especially in early stages, can silently drain your energy without warning. Why does it happen? Because your body is fighting behind the scenes. It's using more energy than usual to deal with a tumor, even a small one. And if your pancreas isn't producing enough enzymes, you're not absorbing all the nutrients from your meals. That lack of fuel makes you even more tired. Cancer-related fatigue is different from the kind caused by stress or aging. It leaves you feeling powerless during everyday tasks like cooking, walking around the house, or even talking. What matters is this: if you feel an unusual kind of exhaustion, and it's paired with weight loss, appetite changes, or digestive issues, take a moment to check in with what your body might be telling you. 9. Unexplained blood clots. A quiet but serious warning. Blood clots usually form when you're injured, or after sitting still on a long flight, or when you're recovering from surgery. But if you're otherwise active, not recovering from anything, not recently injured, and you notice swelling in your leg, a mild aching or tightness in your calf, that could be the sign of an abnormal clot. In many cases, this turns out to be one of the early symptoms of pancreatic cancer. A tumor in the pancreas can release substances that interfere with the body's natural clotting balance. As a result, blood may start to clot in places it shouldn't. This can lead to a condition called deep vein thrombosis, or DVT. If the clot travels to your lungs, it can cause a pulmonary embolism, a life-threatening situation. Clots linked to cancer don't always cause sharp pain. You might just feel tightness, warmth, or heaviness in your leg, the kind of thing you could mistake for a muscle cramp. Here's the key. If you develop a blood clot with no clear cause, and especially if it's combined with fatigue, weight loss, or jaundice, it's time to consider your pancreas as a possible source. 10. Changes in stool and urine color. Small details, big warnings. Most people don't look closely at their stool, and few pay much attention to their urine, unless it smells unusual. But the things you see in the bathroom every day might be your body's quietest way of trying to get your attention. Normally, stool is brown thanks to bile. Urine is light yellow, especially when you're well hydrated. But if your stool turns pale, grayish, even greasy, or floating, if your urine becomes dark, like strong tea, that's worth a second thought. A tumor in the pancreas can block the flow of bile. When bile can't reach your intestines, bilirubin is rerouted into your urine. That leaves stool pale due to a lack of bile, and urine dark due to excess bilirubin being filtered out that way. You might also feel itchy, tired, or notice a hint of yellow in your skin. Just these two changes happening at the same time, stool and urine both changing color, can already be a significant early signal. And as you can see, sometimes the place you pay the least attention to is the first place your body sends a message. When it comes to health, especially serious illnesses like pancreatic cancer, we can't just rely on luck. The human body is a remarkable machine. It has its own way of sounding the alarm when something isn't right. The problem is, many of those signals are small, subtle. So much so that we often overlook them without realizing it. A little unexplained fatigue, a loss of appetite that we blame on our mood, a faint yellow tint in the whites of our eyes, a stomachache we think is just gas. We're all busy. We've all thought it's probably nothing. But sometimes that very thought makes everything come too late. Pancreatic cancer is not a death sentence if it's caught early enough. But in order to catch it early, we need to learn how to listen to ourselves. Never ignore the small changes. Don't brush off persistent fatigue. Don't hesitate to see a doctor just because you worry you might be overreacting. No one understands your body better than you do, and no one can act for you at the right time, except you. If you feel like something's not right, trust that instinct. Talk to your doctor. Ask questions. Request further testing if needed. The truth is, many people have discovered pancreatic cancer, not because they had clear symptoms, but because they paid attention to the little things that most people ignore. Remember, you don't have to be an expert. You just need to pay attention to yourself and not stay silent when your body speaks. And if you have parents, siblings, friends, people who are middle-aged or older, share with them what you've just learned. Maybe it's just a simple evening conversation. Maybe it's sending them a video or article. But you never know. It might save a life. And if today's message brought you any value, leave a comment or share your thoughts with others. Your story might be the reason someone else pays closer attention. We can't prevent pancreatic cancer from happening, but we can get better at noticing it sooner. We can listen more carefully. We can act earlier. And most importantly, we can love ourselves the right way by caring sincerely for even the smallest signs. Thank you for taking the time to listen. Keep taking care of your health. And don't forget, Every day you pay attention to your body is one more day you stay a step ahead of this disease.